Welcome back to the latest episode of what I have learned about AI last week, or I don't know, what are we calling it now these days, Sarah?
I don't know. We got to ask AI for something catchy.
Well, how I AI'd last week. We turned
Yes.
AI into a bird. Okay, so I know that you've been working hard on a few things, and you want to show us a few things you've been doing last week. So,
Yes.
floor is yours.
Well, yeah. One, so I needed to make a quick presentation. I found out like today, and it's due next week. So I actually went to our CVC website Ashley had put together. Can I show it on here,
Yes,
Ashley?
please.
Okay. So I was like, I forget which one Hamid told me to use. That's not the right thing. So I actually came to our website. Ashley put together this like super nice um, table about which ones might be good for depending on like what you need to do. So I was looking through and I'm like, which one should I use for slides? Because Copilot, like, it gives me a good like skeleton of the slides, but I often have to enhance it by myself. So I'm like, I'm gonna try Notebook because Hamid,
Uh,
you showed me
can I,
last week.
before you go to the next step, can you tell us what is that website link? For people that don't know where Ashley keeps all the good stuff.
Yes. Ashley, do you want to tell them? You're probably better than me. And I give Ashley all the credit for this. This is amazing.
Yeah, we have our this is our FCVC Innovation Program's website, and so we have a tab on there specifically for AI and digital health innovations. And so, if you can see the link at the top. It's a Google site, but this is what open and available to anyone, not just U of M people. But this is obviously focused for the CVC community at the University of Michigan. And yeah, we have some resources. We post events that are happening or any funding deadlines that are coming up. That are AI specific, and then now we have this new tools section that we are hoping will help people try to figure out, what use case to use each tool for, if it's compliant for with the University of Michigan. So those top three are all supported by U of M. And then we have links to how to get help if you need help with either of those. And then we list like any different limitations or any costs. Obviously, the ones that are supported by U of M are free. So yeah, I thought hopefully this will help. And then beneath
Yeah,
this,
it
we also
sparked.
have some educational tools and different courses and things that I've just compiled as I've seen them. So yeah.
Yeah, I found it super helpful. So thank you for putting all this together. So I went here this morning and I was like, I need something quick and I can't like enhance it by myself. So I of course signed into Notebook LM at home on my home computer. I can't get into it now, so I'm going to show you the output of it. And the slides are like beautiful. Can you see my screen?
Yeah, can you kind of talk me through like the what did you upload and how did you get to this?
Yes.
Oh,
So what I need to do is essentially we're working on updating ICD-10 codes for cardiogenic shock. So with the SKY framework. So we had a proposal we sent to like CMS for their March meeting. Um, we just heard we were accepted, which is like super exciting, but I need like a presentation by next week. So I uploaded our proposal and asked them to do a presentation that I can present to the committee about, why we're proposing these changes for ICD-10 codes. So all I put in was the proposal and that kind of framework. Um, and these slides that came out were amazing. I could not do this on Copilot. My gosh. So it gave me a 15 slides, which is pretty good. I didn't give it a time limit for my presentation. I don't know yet. I need to get further clarification on that. So right now I have 15, but it gave like this beautiful executive summary, this nice like paradigm shift here, the sky classifications, this bottleneck. Yeah, isn't this beautiful? I was like, what?
I love it. I think it's fantastic. It
Oh
looks like
my
a
gosh.
professionally done.
Yes. And it's like all these things, like I know in my head, and like I can easily present to people, but like taking the time to put them on slides is just like too much right now. So
Yeah. Yeah.
they gave me these like beautiful slides. I'm like, perfect. And then I probably will have to go back and, edit them a bit once I find out, the time frame for the presentation. But I absolutely loved using this.
I think it's like such a, that it takes so much time to build something like this. And what happens is that you spend generally before AI, you would spend all the time putting the slides together and you wouldn't really have any time to practice your
Yeah.
presentation and then
Yes.
communicating the knowledge. Have you
Yes.
tried experimenting with building some um, like learning questions or audience participation slides? Because I imagine I've done it a couple of times where you have the slide and then you know how it generates like questions or cards and you can generate
Yeah.
incorporate some of those in your slides so kind of
Yes.
engage
Yeah.
the
Yeah. Yeah.
audience.
And I'm sure, yes, I'm sure I'll have to once I figure out like the time limit, as I'm sure some of the things will come up in questions, from the audience that I won't have time to cover. But yeah, I thought it was beautiful. And for those other people who are like type A, usually I spend so much time like reformatting and making sure those things are perfect. That just takes so much, thought and time away from the content that I was super excited about
Yeah.
this.
Yeah, and we yeah, what like another trick that I've been using in presentations recently is like I often struggle with you know keeping my tone, speaking direct to the audience. So there are tools now that evaluate your presentation and give you tips as you're
Wow.
going through the slides. Um, I want to say you could do it actually in PowerPoint, but you can actually like video yourself and then have that video analysis through Gemini. And then it gives you great
Wow.
tips on like improving your presentation style. So like I think this is like all kind of you just get to spend more time on like your presence and
Yes.
storytelling and things that actually like make the
Yeah.
presentation
Yeah.
memorable. Yeah.
Yeah. And like I said, this is stuff like, how we made the proposal and all this stuff in our head. So it saved me time putting it down in this presentation. The other thing I wanted to, oh, any other questions on the presentation? Also wanted to show back to Ashley's beautiful table here. I was then exploring, I needed to make a quick forest plot. My like analyst had done some stats, but he's like, oh, you can just put it into a forest plot to submit it to this conference. Anyhow, I need to do that quickly and make it look good. So I was looking through this and I was like, maybe I'm going to try Gemini. So I tried it in Copilot first. I needed to generate a forest plot. Not looking good. Not looking good at all. Yeah. So then I'm like, you know what? We're ditching this. We're going to Gemini. I was super excited. It made it look
Well,
really good. Yeah, it like did it in the like the reference categories nicely.
um,
It had the like TIFF image that a lot of times they want like the higher resolution one. I asked
mhm.
it to make it better just in case we use it for the manuscript, and it did this like this one, which I found hard to interpret. So for the abstract, I went back to one of these ones, but a lot better than Copilot.
No question about it. What model of Gemini did you use here? Is it the fast thinking one or use the Pro?
I mean,
It's
whatever's free. What do we have the
uh,
link to here,
no, no.
actually?
Can you go back to where you were?
Yeah, yeah, yeah.
So you see, like at the bottom, it says fast
Oh, yeah,
at
yeah,
at the
yeah.
bottom. Can you see if you could? There's a Pro option there for you.
It's at the bottom of like when you see tools, when you enter the prompt, it says
No,
fast in the
to,
bottom right hand.
no, in the chat box.
Yeah, if you go to the right,
Oh,
go to the right.
oh.
Yeah, there you
Okay,
go.
so yes, so if you use Pro, I think you'll find that you'll get like significantly better answers, Jenna.
Wow. Okay.
And then if
Should
there
I
are, if you,
try it?
yeah, try it.
I did not
Okay.
know that. That's a good tip. I didn't know there were
Yeah,
different
I
things
thought
you
it
could
was
use.
another thing you were trying to trick me into paying for, Hamid.
So like I use fast for like really easy things. Like if I want to email redone or something quick that you don't want to use a lot of cognitive power.
Yeah, yeah,
And
yeah.
then thinking is really good for like if you need something like stepwise reasoning through something. But I find for the most task, a pro is really vastly superior to the other.
Okay.
So it's
We'll
become
see.
kind of like default. My default is pro. It takes longer. So oftentimes you have to do it and then go do something else and come back. But and then while you're doing that, there's the tools at the bottom. You see the button there
Yeah.
to go in there. So
Oh.
create image is there nano banana. So you can actually have if you want to create an image, you can click on that if you want.
So it was
Uh,
so funny. Yeah, this was the nano banana thing was coming up. I mean, I was generating this at like 4 a.m. today. I was like, am
uh,
I awake yet? Like, what is this banana thing? So this all makes sense.
and then what I generally would do is that you could just say like edit it in the style of JAMA. You can actually
Yeah,
do
yeah,
that,
yeah. The correct. Yeah, yeah, yeah. Yeah,
and then
I thought this was great. Much improvement compared to Copilot. So I
yeah.
was happy about this. Let's see.
Right now, right now, Gemini for me of all the things I've tried for image production is
I
like really
like
the
it.
best. Yeah.
Yeah. So, yeah, this table again pointing me in the right direction. I was excited.
And then the other thing I was going to say, when you're using Notebook LM,
Yeah.
you can link it here. If you go on the plus, I think it's on the plus, or
Yeah.
no,
The issue is like
no, you can't do that. Or what about, sorry, tools? Can you connect yours to Notebook LM?
Canvas.
Yeah, yours doesn't give you an option.
Yeah, again, I forgot how I signed in at Notebook LM this morning. It's an issue with
Yeah,
me
okay.
not signing in.
But
So yeah.
you can kind of like use the Notebook LM and then ask, and then you put a prompt like put it in, change the background to like a U of M slides
Yeah,
that
yeah,
they
yeah, yeah.
upload, things like
But yeah, I needed to show you these slides. I was like, these are
beautiful.
beautiful.
I love that.
Yeah. The other things I thought about, which were creative ways to use it, I always, this is so bad I'm saying this, but, I always try to like advocate for my team members and stuff. I saw in like the headlines, like, the like you can nominate someone for like some award. I always want to do it and then I'm like I don't have time to write a whole thing. So I was like asking this to make nominations for me. But I felt like such a nice, usually I'm like, oh my teammates are so good. I want to nominate them. I just don't have time. So I thought this was a good way to use it.
Definitely. I love that.
Yes. Um Other things I've used it for this week, more like S bars. We're trying to get more pharmacy support on our general cardiology services. So I had it write me a nice S bar and just giving it some numbers. It made me these like nice graphics to include in the S bar. So again, more of that stuff that like I don't even have to do for my job, but I was trying to, help my colleagues and advocate for them. So they were super excited about this. Another thing I used it for, research wise, I have to take like pharmacy students on for some of their research projects, they have to do it just to get some experience. And we are still waiting for some pharmacogenomics data. And we are wondering like what other question we could ask with this data piece so that the pharmacy students can just like fulfill their requirements right now for the course. So it gave me some like really nice ideas too on what we could do with the data we already have. That way we're making a fourth project for the student and they don't have to go back and, collect additional data for their time frame. So that was another really helpful thing. I think that those are my big things this week.
So these are exciting.
Yeah. My best one was that presentation. I was super excited.
More time to take care of patients. I think that's
Yes.
always
Yeah.
great. All right, I guess it's I wanted to show you some stuff this week. So do I share? Oh, it's, you can see my screen.
Yep.
So I was like thinking about like this week was like a little bit of a shock for me, I think, in AI. I think that generally like whenever I was dealing with AI tools before, it was always like, oh, I kind of like do something and it would like I would have to like put some input into it to make it better. And the latest model release, the one that I've been playing a lot with, the Claude 4.6, it kind of like blew my mind for the first time of like the capabilities of it. But what blew me my mind was mostly its ability to self-correct itself, meaning that I would just give it a task and and it would kind of do the task, but then check on itself and then it correct itself. By the
Mm-hmm.
time it would come back, there was really like very little input that I had to have. So,
Wow.
so I think it was the first
And
time
this
that I,
is your prompt to it?
no, I wanted to show you an example of like what kind of capabilities that now exist in the frontier models. Because I think most people don't realize because most people are using the free version, but when you're
Yeah,
using the
yeah.
frontier model, the capabilities now are so much that it's an exponential rate of improvement. So if you can imagine that if a software can improve itself for the first time, meaning AI can actually, we're just entering an exponential improvement phase right now at this moment. So because the next version is going to be so much better with AI is improving itself. Because it's the
Hmm.
first time I noticed that software was like improving itself, right? Which is kind of a crazy thing.
Yeah.
I wanted to kind of show you an example of like I just built this like last night. Have you ever heard of Triz?
Mm-mm.
Triz is like a innovation on demand. Have you heard of it, actually?
No, I was just Googling it as I
Yeah.
saw this because I was interested.
Yeah, so Triz is like it's like a very old engineering innovation concept. I think it's like in Russian it stands for theory of innovation or theory of inventive problem solving, something in Russian that goes to Triz. Um, and it's kind of like, how you've heard of design thinking, obviously,
Hmm.
but Triz is kind of like a product innovation framework where you um like let me just like you can improve something, but then in exchange you're always hurting something else, right? So for example,
Right.
you're building a bottle, um, but you want it to stay cold. You have to add insulation, but then adds weight, which is like all the design compromises that you're making. Um, that's a core idea of Triz is like how can you improve A without actually hurting B idea, right? And there's a whole
Hmm.
set of like innovation frameworks around there. Like they call it the 40 inventive principles or contradiction matrix. It's kind of a really interesting. I've been really interested in it recently. I've been doing a lot of reading about it. Um, so I thought, like I'm gonna meet Sarah tomorrow. Like I was just like sitting, I was like, okay, let's like this. I'm gonna show you my prompts, and I think it's gonna blow your mind. So I said, so I just like so the way I'm doing this now is I'm not typing anymore. I use a software called Whisper Flow. You basically talk like you walk in. I'm just talking to it. So I'm like, you're a world expert software engineer and an expert in Triz for innovation. I want you to create a software. This is a software. Like I want you to create a SaaS system software based
Hmm.
on Triz and innovation methodology that allows users to describe a process in healthcare and then using TRIZ methodology to come up with a set of innovations that improve quality, reduce costs, and improve outcomes. The innovation process could be innovation, basically like something that we would want to do, right?
Right.
It's that set of nurses. And then it says, okay, great questions. Like, and I was like, do you need anything else for me, right? And then so it goes on and says, great question. These are the things you need to think about. And by the way, what I did is I created a project and I uploaded all my notes into this project. all my tris
Okay.
notes beforehand. So it's like, well, maybe you shouldn't kind of focus on a bunch. You maybe pick a few of the tris principles. Kind of when you go to the healthcare domain, do you want to solve for as general health or you want to like specific? What kind of input do you want to ask? Like, give me this, tell me some other information. But it's kind of cool. Like, it's at the end, it's just like, wow, this is, I think, what you should do for an MVP, which is actually quite
Wow.
good. Um, and then so I kind of like went through it and I dictated like, okay, do this, do this, do this, and then I go ahead and build an MVP of the software. Um, and then it kind of built an MVP for you. So sorry, so like build an MVP, created a JSON file for me. So this is it. I can upload it on my, and I want to show you actually the software. Um, but then there was like an error
Wow,
and
it just built that?
it just built that. But like this is what's like this is part that blew my mind here is that it like one area wasn't working. Like there was a
Mm-hmm.
box that I couldn't enter. And then I was like, I can't, I'm like, I'm try typing to describe healthcare process boxes. It does not work. Can you fix it? And it's like,
Mm-hmm.
and it kind of went in there and found the issue. It's like the issue is this. I'll
Mm-hmm.
fix it by doing these steps. And I kind of like did the whole thing and fixed the problem.
Wow.
And then I took it a step. I said, okay, like you're an agent. Go ahead and download this on my laptop, and then give me files to upload it. And then the agent went and uploaded it on my computer and had a running software while I was cooking. Uh,
Wow. So how do you envision you
well, let's do
like
it.
using the software you
Uh,
wanted to create?
I actually never used it, so I wanted to do it while you're here. So this is
Oh.
let's do it together because I'm actually curious. So this is the software. So this is the framework, and it's going to do the TRIZ, like the three things, the 40 principles. These are like
Yeah, yeah,
first
yeah.
principles. And then I asked it kind of like have some regulatory compliance checks in what we're doing. So let's pick, I don't know, HIPAA,
Yeah, yeah.
FDA. Okay, let's continue. What are we gonna call it? Maybe pick ICU.
I see you. Yeah.
All right, so tell me your current process that you want to improve on.
Oh, let's do we want to be able to recognize cardiogenic shock in an earlier sky stage for patients on the floor and in the ED. Man, maybe this can just solve all my issues right now.
Yeah, I actually was thinking about it when I did this. I don't have, sorry, this is a university computer, so I can't use my dictation. Otherwise, it
Oh,
would
that's
just be that.
okay.
Yeah,
I know I can,
that
yeah,
is
in an earlier sky, SCAI, yeah, stage.
it. How are you doing it now?
So right now, a provider would have to, use their clinical judgment and recognize that this patient's in cardiogenic shock, which usually means that it's not until the later stages of Sky C and D where it's more prominent. They're missing those subtle signs like no response to diuretics or, AKI, acute liver injury, those sorts of things, or altered mental status.
I'm not a very fast typer, that's why. Mental status or labs.
Or, yeah, lack of response to escalating diuretics.
So sick, like nervous for my AI here.
Like, we can't understand you. Guy needs to learn how to type.
Well, I haven't typed in like you don't understand. The Whisper AI is so good. I don't type anymore.
Oh my.
So what key pain points? Give me some key pain.
I think lack of, alerts to these sorts of things and
To early signs, you mean? Like
yeah, to early signs and not a standard way to kind of recognize these signs in patients. Like it's just whatever the provider is thinking about.
all right, who's involved here?
I would say the same that they have on here: patients, nurses. Yeah, patients, nurses, providers.
Let's just keep it like we don't have to do it.
Yeah, yeah,
What
yeah.
would ideal look like for you?
Earlier recognition of cardiogenic shock and prompt treatment.
You have any no budget, no limits. Actually, let's say let's just do this. Keep it to the any restrictions. To no additional FT, no
Yeah,
additional.
yeah, yeah.
Um, what's the current metric? Is it time to recognition?
Yeah, and I think we could use, mortality as a surrogate, knowing that the mortality is better if you're catching it, earlier in the stages.
And then you can like upload the sky.
Yeah, yeah,
Um,
yeah.
we don't have that opportunity here. I can when I send you the software, you can. This is just an MVP, by the way. But
Wow.
let's see. It's kind of isn't it kind of crazy? This
Yeah.
kind of like blew my mind of how
I just
like
need to put all my problems in here.
well, I think like what happens is like the obviously there you can see the opportunity that this presents for frontline clinical staff, right? Where like
Mm-hmm.
this is like the issue that most of them have, and then just generating ideas or like actually making it okay. So this is like the function analysis, which maps every action in your process to identify useful functions to preserve and harmful functions to eliminate. So kind of like goes through all the steps, and then it kind of like does target, action, and then the type. So this is the first step in what
Mm-hmm.
we call function analysis. So you break down the steps and you say like this is necessary, this is not necessary. So this generally would be like in TRIZ, you would have to go through it and like actually map every step. So done already.
Mm-hmm.
We could add or like you could look through them, you know the process better. You could obviously add to it or not add to it. We could like um I don't know, like if this was your software, you may want to like have be able to like add a like this is a
Mm-hmm.
step you missed or like modify
Right.
it. So this is just an MVP.
Mm-hmm.
All right, let's identify some contradictions where you improve one thing and you hurt the other thing.
Oh, okay.
Like
Yeah, this is interesting.
I'm curious to see like what that generates, the ideas it
Yeah.
generates. I want to see if like
It better not like find a great solution that I've been like devoting
well,
my life's work here to.
why not?
You're right.
Okay, it happens when you resolve contradictions, right? So improving diagnostic accuracy is one versus wasting workload. Okay, good.
Mm-hmm.
That's a proper contradiction, right? This is a contradiction you have to do. You have to improve
Yeah.
diagnostic, but you don't want to burn them out. Improving clinical reliability, worsening system complexity. That sounds right.
Mm-hmm.
Improving treatment protocol consistency without worsening care adaptability and personalization. Perfect.
Mm-hmm.
Improving level of automation, worsening. So that's like the contradictions there. Perfect. Speed of
Mm-hmm.
diagnosis versus worsening workload. I love it. Wait times versus staffing levels. Fantastic.
Mm-hmm.
Clinical evidence versus waste. Perfect. Information loss. I agree with every single one of these so
Yeah.
far.
Yeah.
Okay, like this just I don't want to read all of them, but all right, it's the next step. Okay, let's run some stew field analysis. That's another step. So this would generally be you would hire a TRIZ consultant, they would charge you $250,000 and they would do this for you. I just
Wow.
I just did it for you.
Wow. Much more quickly too.
But it's yours. So because you have content expertise, you could like build
Exactly. Yeah, 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 yeah.
you can modify this
Yeah.
just you could build an engine of innovation for shock because you know
Mm-hmm.
the intricacies of things that need to be done and you can
Mm-hmm.
modify it. Like the capability that it allows, it's kind of like this week I was like just my mind was so over when I used it and I this when I it's also the same the Codex, which is the ChatGPT model, also was released, which has I haven't used it, but my colleagues are saying that it's even better than this in
Wow.
and the crazy thing is that Codex built itself, meaning AI built itself.
That
So
is crazy.
So substance field analysis models your process as an interaction between substances and fields. So patient versus clinical judgment, these are good.
Mm-hmm.
Um, Patient hemodynamic lab data versus EHR monitoring, that's good too.
Mm-hmm.
Cardiogenic shock indicators like rising lactate versus nursing assessment. I like that.
Mm-hmm.
Patient urine output versus diuretic therapy tracking. Like we didn't say any of this stuff,
No.
right? Okay. Patient receiving standardized sky stage recognition versus standardized
Yeah.
recognition. This is
I like it.
like we didn't give it any other context. You saw what I just gave, right?
Yeah.
All right, let's run the ARIS analysis.
Is this where it's going to give
I don't,
ideas?
I've never run this software. So this is the first.
Wow. Okay, we'll find out. I'll probably be like, you need to pay this amount to find out what we recommend.
I don't think so.
I'm just kidding.
All right. It's the ARIS ideal final results. And many problem is how can early sky stage cardiogenic shock be reliably recognized in the ICU patients without increasing cognitive burden on already overburdened providers? That seems perfect, right?
Mm-hmm.
Conflicting pair is EHR monitoring system and provider judgment collects all the necessary data but does not synthesize it. That seems pretty good. The physical contradiction must highly engage to synthesize subtle composite signals of early cardiogenic shock and recognize and cognitively rested and unburdened to maintain the pattern recognition capacity. I love it. All right. And then you have to now resolve the resolution by separating the condition under which cognitive engagement is required from the condition under which raw pattern recognition occurs. I like it. So basically, early CDS system, EHR composite
Yeah.
CDS alert hand is first pass. Okay, so this is like the kind of a solution, but let's go to the next step. So this is like the last step. We call there is ideal final result. This is like the resolution. So you basically map the stages, you figured out the contradictions, and you came up with like an ideal result. But let's see like what some solutions that it gives you.
Yeah.
Run. The last stage is the trimming. I want to move to that one because I think we're running out of time. What do you think so far from what I?
I like it. Yeah. I'm surprised they recommended clinical decision support. We've tried it,
No,
you
no,
know.
this is not right. It's not making any recommend. I think the last stage
Oh,
is it comes up with that right with the
oh, the recommendation that it had was just a general.
yeah.
We'll see what it says. I like the process that it takes you through because I think a lot of times it's like, how do we even think about, solving these issues? So I think it's helpful to think of them those ways and notice like the areas that we could intervene on.
But what the what I love about it is that it gives anyone to like make their personal software. Like you could build
Yes.
a software for you that
Yes.
deals with like the Adie household, you know, in like uh
And
Ashley,
just
what do
solve
you
all
think?
my problems.
Yeah, I mean, I like this. I feel like we talk to so many people who have general ideas or have
Yes.
problems that they're thinking about and they
Yes.
don't really know where to start. So I think
Yes.
having some sort of software like this to just kind of get
Yes.
ideas to then put together an innovation challenge proposal or
Yeah.
something like that, that would be very helpful.
Yeah,
Well,
that's a
I
great point,
think,
Ashley.
and then we could like this is just an MVP I built just like by talking to it, Ashley. But like we can imagine that we could like upload all of our like learnings and
Mm-hmm.
lectures that we have for. We could turn um our innovate like Aiken's Innovation Academy into like a software that supports our innovators, for example, through an app that they could have with. I don't know. I mean, there's just opportunities are incredible. I think like anyone can like we could turn all the knowledge that we have and provide a software for people.
Yeah, I really like the point Ashley you said because I think we do get a lot of people saying like I see this problem, I don't know how to fix it, especially it has that feature where you can like make it your own saying like I have we don't have any extra FTE. We don't have any funds. Like what can we do with what we currently have? I think it helps you think outside the box.
Yeah, I think it's great to like supplement then forming your idea
Yes.
list and then kind of trying to then figure out, okay, this is kind of what we can do. Who else should I talk
Yes.
to internally? Like, and things like that. It kind of just like helps start the process along a little bit. And I
Yep.
wouldn't say it's going to do it for you, but I think
Yeah,
it
yeah, yeah.
supplements.
Yep.
Oh, hang on. Uh-oh. I think my AI is breaking down here. I built it up too much.
You need another AI to fix it.
Yeah. Um, yeah, I built it up too much. But I should have run it at least one time through it, I think.
No, this is
It's
better.
good to
This
test.
is better.
I
I
mean, I
just
think
wanted
the
to like,
fact that you built this in Claude is something that I did not even know is something you can
Yeah.
do. You're using a paid version though, correct? Of Claude?
yeah.
Yeah.
This is like you see, I don't know if you can see it. This is Claude extended
Oh, yeah.
4.6. Um, And then you want to go to 4.6 is where like really where I think it's kind of crazy what it's doing because imagine like it can build a software, but not only that, it can go and install it on your computer and then run
That's
it.
crazy.
And then it can go do user testing of it by itself, like go check to see if users click through all the buttons, see if they're working. Um, I haven't like built all that capabilities into it, but it's like it's kind of like anyone can be a software engineer, you know?
Which is worrisome in some contexts.
What's that?
A little worrisome in some contexts, but it is helpful for some things, yes. I'm
Oh,
sure
I got you. It's not
software
working.
engineers who've been working their lives to do these things might feel differently, but
Yes, I think that what I wanted to bring this up is like there's definitely areas that AI is already better than 99.9% of people. Obviously, there's 0.1% software engineers that are always going to have jobs, but I think making everyone, and it's kind of like what YouTube almost allowed, right? Like it made everyone be able to make a movie, right? Then you're not getting less movies, you're just getting a lot more and movies, right? So I think it's you're still going to need software engineers, but then there's that the capabilities opened up to everybody.
Yep.
yeah, I've used for our Google site. I have used it to create HTML to put in that Google site. And that's the same kind of thing. Like that these Google sites made it way more accessible to more people to make their own website.
Yeah.
But I'm not a coder. And so yeah, there are ways that it's very helpful in that sense. Yeah.
Okay, so it's not this button's not working for me, so I'm gonna ask it to fix it for me. All right, well we can maybe like
I think
You
this is
get
a good
you get the
example though,
point.
because
You
my
get the
experience with
point.
AI is have to do this a lot where it takes a long time and then I have to fix things and ask it to fix this and then sometimes they also create something that then something else needs to be fixed. So it's not perfect. Like it does actually take some
Yeah.
time to like really hone in. And not saying that's a bad thing, but I think some people think, "Oh, I'm going to put this in AI and just get everything I need." And that is not how it has worked for me. It takes a lot of like troubleshooting and going back and forth.
Redirecting. Yeah.
I think it's becoming less and less though. Like this thing here, like I just created a SaaS software with like just talking to it for like 10. Now there's obviously some errors here, but I haven't even spent 2 hours on it.
Yeah.
So, and this is like crazy for me that from the leap from 4.5 to 4.6, the capability leap is really incredible.
Yeah. This is amazing.
Anyways, so I challenge you, Sarah, next week to build a software for to solving one of your problems.
Oh gosh. I cannot pay for this extended version here.
It's
I
twenty
need your
dollars a month.
sign-in information. No.
I might just give you access to my account so you can
Yeah.
just build
Just send me the software.
after I
This
fix
was
it.
great though. Yeah, I think a really good and useful tool to help spark some ideas for improving patient care.
Yeah, I'll send you the MVP of the software. And
Yeah.
it, like, look at how it's solving the problem here. I'm like, oh, this is not working. And it's going in and like actually troubleshooting right through it.
Yes.
I don't have to do write any code.
Yeah. This is great. You keep finding new things.
Sorry, let me just stop sharing here. Yeah, I was thinking we're like, I'm just like, it blows my mind every week
Oh
with
yeah.
the capabilities that are coming online. And
Yeah.
I think it's just starting.
Yes.
I think
Yeah.
what we're seeing in software engineering now, that kind of capability is going to translate into other fields. I
Yes.
think specifically the AI labs have picked software engineering first because it allows them to um, exponentially improve the code that requires to improve intelligence,
Mm-hmm.
right? So if you have a software that can improve itself, then everything else is downstream from it because intelligence just exponentially gets better.
Mm-hmm.
So you're like just kind of like if this is an S curve, we're just at the bottom of it. We're just gonna go like this on the explosion of intelligence. So whatever we've seen so far is nothing about what we're gonna see in the next year.
Wow. I'm
Positive.
just here writing nominations on Copilot. Yeah, you're doing like some writing some software codes here.
I'm not writing any. I'm just like telling it to do it, and it goes and does it. It's kind of cool. But
I love
what I
it.
imagine is like for our group's sake. So I imagine that what you're gonna get is we have the capability now to like democratize like the processes to everybody. Um, we have the ability to like explode the number of ideas that can be generated for solving a particular solution. And but that those solutions still need to be tested. They still need to be implemented. Um, and that's going to be
Mm-hmm.
like where like the majority of the work is going to be focused, which is what we do anyways. And we don't have to worry as much
Right.
about like I think it's just gonna our inbound could potentially like quit 10x in next year if
Mm-hmm.
we're using tools like this because you could just essentially what you need to do is say, this is what I'm doing. This is the process of whatever, like I don't know, pick a process, and then we can generate thousands of ideas and
Yeah.
thousands of ways to test it.
Yeah. I love it. Well, thanks for showing me that. Yeah. I'm going to use that software now just to solve all my issues.
I need to fix it for you because I've
Yeah.
been using
Fix
it.
it, send it to me, and then I can just solve all the problems.
Oh, it fixed it already. Oh, but I have to rewrite everything into it. Yeah. Well, maybe another time.
Any
Next
final,
episode, the reveal.
Next
any
time.
final thoughts before I stop recording?
I really think everyone should find $20 a month and subscribe and try to get the Frontier models. Use the Frontier ones. There's a big difference between the free one and the Frontier models.
Okay, thank you, Hamida. I'm gonna stop recording now. Thanks so much.